Have you ever had that nagging feeling that something isn't quite right with your horse, but you just can't really put your finger on it? We often focus on the obvious things, right? Lameness, colic. But some of the most crucial health concerns can be subtle, sort of hidden, or just easily overlooked. Today, we're going to shine a light on one such area. It's absolutely vital for a horse's comfort, their well-being, and even their ability to breed. We're talking about penile lesions. Welcome to the deep dive. For this deep dive, we're taking a closer look at, a critical and, let's face it, often sensitive topic, penile lesions in horses. Our sources today are drawn straight from comprehensive veterinary texts, so we're getting a really thorough, practical understanding of these conditions. Why does this matter to you? Well, whether you're a horse owner, a breeder, or just an enthusiast, understanding this stuff is paramount. Early detection, proper management. It can genuinely transform your horse's prognosis. It ensures their comfort and, preserves their potential. We'll be exploring the different types of lesions, what causes them, the signs to look out for, how vets actually diagnose them, and crucially, what treatment options are available. Okay, so let's unpack this. When we talk about penile lesions in horses, what exactly are we referring to?
Right. So we're essentially talking about any kind of abnormal change on the penis itself or on the preputial folds. This is the sheath. It could be a fluid-filled blister, vesicular, or an eroded area, an ulcer, or even some kind of abnormal growth, what we call proliferative.
Gotcha. So basically anything that isn't smooth, clean skin.
Exactly. And what's really insightful here, I think, is that a healthy penile surface should be smooth when it's clean. Any irregularity can signal a problem. And these issues, they tend to fall into broad categories. They could be infectious, maybe caused by trauma, inflammatory reactions, or even neoplastic, that means tumor-related.
Neoplastic.
Yeah. And what's fascinating, really, is how these seemingly isolated issues can sometimes be a clue, like a canary in the coal mine, for bigger health problems going on systemically. It just highlights how interconnected everything is in a horse's body.
That makes sense.
And these conditions, they aren't picky. They can affect any age, any breed, and you find them pretty much worldwide.
Okay, that interconnection point is really interesting. So let's dive into some of the more common culprits than the infections and parasites. Sounds a bit unpleasant, maybe, but it's absolutely essential for owners to understand these potential hidden invaders.
Absolutely. So one of the most common infectious things we see is equine coital exanthema. It's caused by a virus, EHV3. It's a highly contagious venereal disease.
Okay, EHV3, how does that one look?
Typically, it starts as these small raised bumps, papules. Then they become vesicles, little blisters. Then pustules, so they fill with pus. And finally, they rupture and form these quite painful open sores or ulcers. The whole process usually unfolds pretty quickly, maybe 4 to 7 days after the horse is exposed.
Wow, that's fast.
It is. Now, while there's no proven long-term carrier state where the horse stays infectious forever without signs, what's really crucial to know is that horses can shed this virus even before you see any blisters.
Oh, right.
And stress can actually cause it to flare up again, a recrudescence. A key diagnostic clue, even after it's healed, is you often see these distinctive gray, sort of irregular patches left behind on the skin.
That shedding before signs appear? That sounds like a real problem for spread, especially in breeding situations.
Oh, absolutely. You
Yeah.
can imagine natural breeding programs are much more prone to outbreaks than places using AI, artificial insemination. It's just down to the direct contact.
Makes sense.
And yeah, unsanitary breeding practices definitely increase the risk factor. Another common issue we see is habronomyosis, which most people call summer sores.
Summer sores, okay. I've heard of those.
Yeah. Now, this isn't an infection like EHV3. It's actually a hypersensitivity reaction, like a severe allergy, to the larvae of stomach worms, Habronema larvae. What happens is stable flies pick up these larvae and deposit them on moist areas like the penis or the sheath.
So wait, it's a fly bite reaction, but from worm larvae. That's
Yeah,
interesting.
Exactly. It triggers this intense itching, what we call pruritus, and you often find these characteristic Bollinger's granules.
Bollinger's granules, what are they?
They're these small, gritty, sort of yellowish masses, cakey masses. You often find them right on the tip, the urethral process, or maybe around the preputial ring, the opening of the sheath.
Right.
And it's highly seasonal, as the name suggests. Crops up in hot, humid weather, spring and summer mostly.
Right.
And poor fly control or maybe unsanitary housing conditions significantly raises the risk of it happening.
Right.
There are a few other things we might see, too. Vesicular stomatitis virus, VSV, that's another virus, spread by biting insects or direct contact. It usually causes blisters and erosions in the mouth. but it can also affect the penis. And it's really important for owners to know VSV is a reportable disease. You have to notify the authorities.
Okay, good to know.
Then there's balanoposthitis. That's basically just inflammation of the penis in the prepuce, the sheath. It's often linked to simple things like poor hygiene. You get that waxy buildup, smegma,
Yeah.
and that allows bacteria or fungi to overgrow. Sometimes it can even be an allergic reaction. And then very rarely, there's something called pemphigus vulgaris. It's a serious autoimmune disease that causes blistering, and it can lead to persistent, really painful erosions.
Wow. Okay, that's quite a list just on the infection and inflammation side.
Yeah.
But what about, the more serious stuff? Let's turn our attention to tumors, neoplasia. I imagine those can be particularly challenging.
They absolutely can be, yeah. The most common penile tumor we encounter in horses is squamous cell carcinoma, or SCC.
STC, right.
This one can look very different from horse to horse. Sometimes it's like a bumpy proliferative growth, kind of looks like cauliflower. Other times it presents as a nasty, destructive ulcer, a non-healing sore. What's really crucial for people to understand is that it's locally invasive. It tends to grow into the surrounding tissues. And in more advanced cases, it can actually metastasize, spread to the regional lymph nodes and even other organs.
That sounds serious. Are there known risk factors for SCC, things owners should be aware of?
Definitely. Horses with light-colored skin, unpigmented skin, are at higher risk, especially with exposure to UV light, sunshine.
Okay.
Older horses, too, the average age is often around 17 to 19 years old. Chronic irritation is another factor, often from that smegma accumulation we talked about, if it's not cleaned regularly. And interestingly, there's a strong link now recognized with a specific type of equine papillomavirus, ECPV2.
A virus link?
Yes. And we also tend to see it a bit more often in geldings compared to stallions, though stallions can certainly get it too. Another type of tumor is melanoma. You mostly see these in gray horses.
Right, those black lumps.
Exactly. They typically look like firm black nodules, often around the perineum or on the sheath itself. Now, while many melanomas in older gray horses behave benignly, they can become malignant, especially if they appear in non-gray horses or younger animals, so they always need watching. Then there's sarcoids. Sarcoids are actually the most common skin tumor in horses overall, and yes, they can definitely show up on the penis or sheath. They're associated with bovine papillomavirus, BPV, and their appearance is incredibly variable. It could look like a wart, a fleshy lump, a flat sort of scaly area, or even a more aggressive ulcerated lesion.
So they can look like anything, basically.
Pretty much. The really challenging thing about sarcoids is that they're locally very aggressive and infiltrative. And they have a very high rate of recurring after treatment.
Oh, dear.
Yeah. Though generally they don't metastasize to other organs, which is one small mercy. And then we have papillomas, what most people just call warts.
Right.
These are caused by equine papillomavirus, ECPV. In young horses, they're usually benign and often just disappear on their own after a while. However, genital papillomas, especially the ones linked with that ECPT2 virus we mentioned with SCC, those can sometimes persist. And, concerningly, they do have the potential to progress into squamous cell carcinoma later on.
Ah. So a wart isn't always just a wart there.
Not always, no. It needs monitoring. And beyond these main types, other things can cause lesions too. Direct trauma, like a kick from another horse or an injury during breeding, or even bacterial infections leading to abscesses, sometimes linked to complications from things like bastard strangles.
Okay. Wow. So we've got this really wide array of potential issues from, relatively simple infections right through to serious tumors. It sounds like it could be a real diagnostic puzzle for a vet. What's the process? How do you actually figure out what's going on when an owner brings a horse in with these kinds of signs?
That's an excellent question because you're right, it does require a really systematic approach. The first, and honestly the most crucial step, is a thorough examination. And for that, sedation is mandatory. You have to sedate the horse.
Right.
And then you need to manually extend the penis fully. You need to be able to see everything, touch everything, palpate it properly. Without that, you just can't get the full picture. It's impossible.
Okay, makes sense. And when you're doing that exam, what are you looking for specifically? Are there clear sort of giveaways for different conditions?
Yeah, there definitely are clues. For EHV3, for instance, we typically see multiple small, like 1 to 2 millimeter circular bumps that then progress to those classic 5-10 millimeter ulcers. Confirmation often comes from lab tests, maybe virus isolation from fluid from a blister, or looking for a rising antibody level in the horse's blood over a few weeks.
Okay.
We can also look at cell samples under a microscope, cytology, to spot characteristic changes inside the cells caused by that virus. For Hebertomyces, the presence of those gritty Bollinger's granules and that really intense itching are usually pre-diagnostic.
Ah, the granules again.
Yeah. And for neoplastic lesions, the tumors like SECs, they often have that ulcerative eating away appearance or that lumpy proliferative look. And a vet will be carefully feeling for signs of local invasion, how deep it goes. But really, the gold standard for a definitive diagnosis, especially when we suspect a tumor, is a biopsy.
Biopsy, right. Taking a sample.
Exactly. We take a small tissue sample and send it off to a lab for specialized analysis. They look at the cells under a microscope that's called histopathology. And it's absolutely crucial because that tells us exactly what type of cells are there, what we're dealing with. Is it cancer? What kind? How aggressive does it look? And that information directly guides the entire treatment plan. It's essential.
I see.
We might also use other advanced tests, like PCR to confirm a virus, or sometimes imaging ultrasound, maybe even a CT scan in some cases,
Sure.
to see how deep a lesion has invaded or if the nearby lymph nodes look involved.
Okay. So once the vet has that definitive diagnosis from the biopsy and maybe other tests, what's the path forward then? What are the treatment strategies and what can an owner sort of expect?
Well, the general principles of treatment kind of across the board usually involve a few key things. Daily cleansing of the affected area, usually with mild, gentle washes. Pain control is important, often using NSAIDs, non-steroidal anti-inflammatory drugs.
Like bute or Benamine?
Exactly. And antibiotics, if there's evidence of a secondary bacterial infection setting in on top of the main problem. Now, for EHV3, the good news is that it's usually self-limiting. It tends to clear up on its own within, say, 3 to 5 weeks. The single most important thing here is complete sexual rest. No breeding activity. For at least 3 weeks, or ideally, until every single lesion is fully healed. That's critical to stop it spreading.
Okay, sexual rest. Got it.
Yeah. And applying some topical soothing ointments, maybe with a mild antimicrobial, can help keep the horse comfortable while it heals.
And what about those pesky summer sores, the Habertomyces?
Right. For Habertomyces, the key is to get rid of the parasite larvae causing the reaction. We do this using systemic dewormers, specifically ones like ivermectin or moxidectin, which are effective against these larvae.
Okay, deworming.
Yep. Topical medications can also help manage the inflammation and kill any larvae on the surface. Things like corticosteroids, maybe some organophosphates carefully applied. Sometimes, if there's a lot of residual scar tissue left behind after the inflammation settles, surgical removal or debridement might be needed to sort of tidy it up. But truly, the absolute cornerstone for preventing it coming back season after season is aggressive fly control. You have to manage the flies.
Right, break the cycle. Makes sense. Okay, now on to the tumors. Neoplasia. You said treatment there often involves multiple approaches.
Yes, that's very common because tumors can be quite variable in how they behave, and unfortunately, recurrence rates can be high for some types. So we often need a multimodal approach. For SCC, squamous cell carcinoma, the options range quite a bit. Surgical excision is common, sometimes just removing the local tumor. Sometimes it might require partial amputation of the penis, a phalectomy, or even total phalectomy in very severe invasive cases.
Wow.
Using a specialized CO2 laser for the surgery can be very precise and helpful. We can also use localized chemotherapy, injecting drugs like cisplatin or 5-FU directly into the tumor. Radiation therapy is another option, or cryotherapy, using extreme cold to freeze and destroy the tumor cells. Sometimes systemic NSAIDs, like piroxicam, are used as an adjunctive therapy too. For melanomas, if they're small and seem benign, especially in an old gray horse, sometimes we just monitor them closely, watch and wait. For larger ones, or ones causing problems or those suspected of being malignant, surgical removal is often the way to go. We might also use intralesional cisplatin, like with SCCs, and there's immunotherapy, like the onseptimelanoma vaccine, which aims to stimulate the horse's own immune system to fight the cancer cells. Some people use cimetidine orally too, though the evidence for that is more anecdotal.
Interesting, the vaccine approach.
Now, for sarcoids, they are particularly challenging, as I mentioned, because of that high recurrence rate.
Right.
So again, multimodal therapy is usually bust. Surgical excision, often using a CO2 laser to reduce seeding of tumor cells, local chemotherapy, radiation, cryotherapy. And immunotherapy can be quite useful too. Things like topical imiquimod cream or injecting BCG vaccine directly into the sarcoid.
BCG, like the tuberculosis vaccine.
The very same. It causes a strong inflammatory reaction that can sometimes destroy the sarcoid cells. And then papillomas, the warts, As we said, they often regress on their own, especially in young horses. If they persist or cause issues, surgical removal, cryotherapy, or topical imiquimod might be used. But the key is continued monitoring because of that potential, albeit small, risk of progression to SCC later on.
That's a lot of sophisticated treatments available. Beyond what the vet does directly, what can owners do on a regular basis? Is there anything proactive to help prevent these issues in the first place?
Absolutely. Client education here is just vital. It really boils down to a few key things. Performing regular and proper cleaning of the penis and sheath is so important. Removing that smegma buildup regularly reduces chronic irritation, which we know is a risk factor for SCC.
Okay, regular cleaning. How often is regular?
That can vary a bit depending on the horse, but checking it periodically and cleaning as needed maybe a few times a year for many geldings, perhaps more often if they tend to accumulate a lot. It's about knowing your individual horse. For breeding stallions, regular, thorough examinations by a vet are crucial. And if you were doing natural cover breeding, pre-breeding exams for both the stallion and the mare, and maybe quarantining new mares coming onto the property, can significantly reduce the spread of infectious things like EHV3.
That preventative information is just so incredibly important, isn't it, for long-term horse health? Okay, so thinking about the long view, what should horse owners know about the prognosis, the long-term outlook, and maybe potential challenges or complications once these conditions have been diagnosed and treated?
Yeah, the prognosis really varies widely. It depends entirely on the specific cause and, critically, how extensive the lesions are when they're diagnosed. For something like EHV3, the outlook is generally very good. It typically resolves on its own without long-term issues, apart from maybe those pigment changes. However, for aggressive squamous cell carcinoma, especially if it's already metastasized, or for that rare autoimmune condition, pemphigus vulgaris, the prognosis can be much more guarded, even poor sometimes.
Right.
Hebernomyces, the summer sores, usually has a good prognosis with treatment for the acute episode. But as we've stressed, seasonal recurrence is really common if that underlying fly control isn't diligently maintained. You have to stay on top of it.
And what about potential complications that owners should be aware of, things that might arise either from the condition itself or maybe the treatment?
Good question. With chronic, repeated Habronema infections, you can sometimes get significant scarring, fibrosis, around the urethral process, the tip of the penis. In severe cases, that might even necessitate surgical amputation of that affected part.
Oh.
We can also see functional problems, like phimosis. That's when the horse physically can't extend its penis from the sheath, or the opposite, paraphimosis, where it's stuck out and can't be retracted. Both can be emergencies. With malignant tumors like SCC, obviously the biggest long-term concern is the potential for metastatic lesions, the cancer spreading to regional lymph nodes, lungs, or other tissues.
Yeah.
And, as we noted, there's that possibility, though usually low, of some papillomas eventually progressing to SCC. It's also really crucial to monitor for any signs of urethral blockage, difficulty urinating. That can happen either from the lesion itself obstructing the urethra or sometimes as a complication of certain treatments or swelling post-treatment. So, prevention is always the best strategy where possible. Avoid breeding with active EHV3 lesions and remember that shedding can occur before you see those blisters. Vigilance is key. Excellent fly control is just non-negotiable for preventing Habronemiasis. Regular cleaning to prevent that smegma buildup significantly reduces a known risk factor for SCC. Good general biosecurity practices are important too for all sorts of reasons. And for those lightly pigmented horses, things like fly masks that cover the sheath area or limiting turnout during peak UV hours might offer some protection against UV-induced cancers. But the clearest message, the real takeaway here, is that any abnormality you notice on your horse's penis or sheath, any lump, bump, sore, discharge, swelling, warrants a prompt and thorough veterinary examination. Early detection and aggressive management truly make all the difference in the outcome for these conditions.
And there you have it. Understanding equine penile lesions, from those common infections and parasitic invaders right through to the more serious tumor types, it really equips you with absolutely critical knowledge. Knowledge for protecting your horse's health and their overall well-being. We've explored just how varied the causes can be, how distinctive some of the signs are, and how absolutely crucial expert veterinary care is for getting an accurate diagnosis and then implementing effective and often, as we heard, multimodal treatment. So what does this all mean for your approach to horse care? Think about it. Given the often hidden nature of many of these issues and the significant impact that seemingly small factors like, routine hygiene or fly control can actually have, how might paying closer attention to these details, maybe doing that sheath check a bit more regularly or being more diligent with fly spray, how might that not only ensure the immediate comfort and health of your horse, but also potentially safeguard the continuity of a valuable breeding line if that's relevant for you, or simply extend the active, comfortable life of a beloved companion? It makes you think, doesn't it? About what you'll start looking for, perhaps differently now, and how you'll communicate with your veterinarian, armed with this new, deeper understanding. We really encourage you to continue your own journey of discovery because, as always, there's always more to learn in the deep dive.